Hello, my name is Jane Roberts.
And I'm Allie Brown.
We have been with the HELP program since May of 2022. We have been working with HELP coordinators Dr. David James and Terry Middlebrooks.
HELP stands for Hospital Elder Life Program. This program began in 2015 in the UAB Highlands ACE unit, and it was solely in the ACE unit until October of 2022 when it expanded to the 4N Med-Surg unit, which was one of our project goals. The HELP program fills the gap by focusing on preventing delirium in hospitalized patients. One way it does this is through range of motion and walking protocol activities. Our project goals closely align with the goals of the HELP program to help streamline the services and make achieving their goals easier. This chart represents yearly averages for the HELP program. It represents averages from the years 2019 through 2022. As you can see, in 2022, services increased post-COVID because restrictions were lifted. It's important to note that many volunteers are students, so services increased during the summer months and holiday breaks. Right here, we would like to highlight the years 2020 and 2021 because HELP services were very low as compared to other years. This was due to the HELP program being paused from March 2020 to August 2021 due to COVID restrictions. The year 2020 only has averages for January and February due to the shutdown in March, and 2021 only shows averages for August through December, whenever the volunteers were let back in to perform services. At the beginning of our project, the client was seeking services to expand HELP from the ACE unit to the 4N unit, because HELP was limited to the ACE unit and it had only ever provided services in the ACE unit. The client was also seeking services to re-implement the HELP walking protocol post-COVID pandemic, making improvements to the protocol and analyzing the changes through volunteer feedback. The walking protocol had not been implemented post-COVID, so the client wanted the protocol to be reviewed, updated, and re-implemented. Most of the current HELP volunteers had never performed the walking protocol, so they needed to be trained and validated. The client was also seeking services to streamline communication between staff. So the way that communication was streamlined between staff in the HELP program in the ACE and the 4N units was by creating various documents throughout our project. One of those documents became the final RN approval sheet, which will be discussed later. The HELP program is now serving patients in the ACE and the 4N unit, and looking at the typical admitting diagnoses for these units, they are similar. These typical admitting diagnoses were provided by nurse managers in the units, and they are similar. So by expanding the HELP program to the 4N unit, this transition was expected to be smooth because many of the volunteers are used to working with patients with many of these admitting diagnoses. Looking at the walking protocol averages, this is from 2019 to 2023. In 2019, you can see for each month in 2019, there was an average of 13 patients who were walked. And then this number dipped down from 2020 to 2022 as the walking protocol was stopped. It was re-implemented through our project at the end of 2022. And so far in 2023, there has been an upward trend of patients who have been walked. It's important to note that the 2023 averages only represent January and February data, but the client expects this trend to continue. So by expanding HELP at UAB Highlands to the 4N Med-Surg nursing unit, and by re-implementing the HELP walking protocol, this was expected to increase the overall well-being of patients by decreasing delirium, providing companionship, increasing mobility, and reducing the average length of stay. The goals for our project were, the first goal was that the client would implement a safe walking protocol for HELP volunteers, allowing for ambulation of 10 patients per month by April 1st, 2023. The second goal read, client will evaluate the beta testing of HELP in the 4N unit and make recommendations based on feedback from stakeholders and analysis of health metrics by January 2023. The process of the walking protocol being re-implemented was tested repeatedly until the client was satisfied with the updated walking protocol and was ready to implement and train volunteers. So far, the client has begun training and validating HELP volunteers. So far, there are five HELP volunteers who have been trained, and they are working towards being validated to perform the walking protocol.
This is the volunteer sheet for the walking protocol. It has been edited and reviewed many times after performing the walking protocol and meeting with HELP coordinators, the lead OT at Highlands, and mobility techs at UAB main campus. The minutes section in this sheet has been highlighted, and it was added after shadowing mobility techs at the UAB main campus. It shows how long the patient has been walked and is a good comparison and baseline for future walks with volunteers. The include any equipment needed for walking was added after interviewing the lead OT at Highlands. It is good to note that any assistive devices that patients use should be documented so that future volunteers know which patients will use assistive devices. This is the RN approval sheet for the walking protocol. While evaluating and performing the walking protocol, time was lost due to the need to locate patient nurses and to obtain final approval for walking patients. The sheet was developed to streamline communication between professions, and it also serves as a permanent documentation for proof that nurses gave their final approval for volunteers to walk their patients or to not walk them. The HELP staff section in yellow is based off of the ACE tracker criteria and is filled out by HELP staff. It is then given to the unit secretary, even though HELP staff records who is eligible for the walking protocol. Volunteers are required to get approval from patients' nurses because their status could have changed since the ACE tracker was printed. The unit secretary fills out the section in blue and reminds the nurse to fill out the section in pink, which is a check yes or no for approval or not. The nurse can also write notes in the section if applicable. The mobility tech fills out the green section as appropriate. If the mobility tech has walked the patients that day, they are able to give the time of day that the patient should be walked again. This avoids patient fatigue and saves the volunteer time. These are our walking protocol additions. These were added for safety and include how to don and doff a gait belt, as many volunteers are not familiar with this healthcare setting. A PPE and walking checklist was also added in addition to the COVID-19 protocol and is no longer being implemented due to the change in the Highlands masking policy. Both of these items are on the back of the volunteer documentation form so that volunteers can easily reference these as needed while walking patients. The walking protocol was implemented on the 4N and ACE unit. Staff awareness has improved of the walking protocol and of the documentation sheets, including the updated volunteer documentation sheet and the RN final approval sheet. HELP was test ran, and so was the walking protocol in both units, the ACE and the 4N. Data was collected from stakeholders to improve the walking protocol process and documentation. The walking protocol process and documentation was standardized in both units, and HELP was implemented on the 4N. The finalized process, documentation sheet, and education documents were approved, and the volunteers began being trained for the walking protocol by the client. At the beginning of our project, HELP hoped to have 25 volunteers, and they currently have 27. The final RN approval sheet is not being implemented daily, but once HELP volunteers are performing the walking protocol daily, the sheet should become routine and prove effective. Here are our resources listed for our project. Thank you very much.